So we continue our video on the foramen lacerum, and it has to be divided into two parts because of some parental intervention. तो foramen lacerum में तीन चीजें हैं. One, that is transversing it wholly. जिस तरह ये पेन ट्रांवर्स कर रहा है उस तरह it is the meningeal branch of the ascending pharyngeal artery. The canal of pterygoid giving the nerve of pterygoid, in a nerve of pterygoid canal pierces it anteriorly and gives off the greater petrosal and the deeper petrosal nerve inside the foramen lacerum. Now, on the posterior aspect, internal carotid artery pierces it and it emerges out of the foramen lacerum and enters into the carotid canal. So there are three structures that are intimately related to the foramen lacerum. Now we will come to the foramina of the posterior cranial fossa. We will go from above downwards. First we will go to the internal acoustic meatus. There are four structures that are passing through the internal acoustic meatus, and here you can see in the petrous part of the temporal bone and superior aspect, it is the nervus intermedius, labyrinthine artery, vestibulocochlear nerve, and the facial nerve. So these are the four structures that are passing through it, and also the facial nerve sometimes pass through it. Facial nerve हमने बात कर ली, हाँ, facial nerve passes through it. It always passes through it, not sometimes. Now we will come to the jugular foramen. Jugular foramen gives the origin to the glossopharyngeal nerve, vagus nerve, accessory nerve, inferior petrosal sinus, sigmoid sinus, and the internal jugular vein. So there are one vein, two sinuses, and glossopharyngeal nerve, vagus nerve, accessory nerve, three nerves which are rising together. Now this is the hypoglossal canal. Here. It is the hypoglossal canal which is giving the hypoglossal nerve, which is also giving the meningeal branch of the ascending pharyngeal artery, and it is also connecting it is also giving an emissary vein which is connecting the basilar plexus with the internal jugular vein. Just posterior to it we have a condylar canal that is emitting the emissary vein. Now coming to the largest foramen and the last foramen, it is the foramen magnum, and this foramen magnum is transmitting a number of structures. So we have divided it into three parts, that is the anterior most part, middle part, and the inferior part, posterior part. The first part, the anterior most part, is supplying the tectorial membrane and the apical ligament of dens. The middle part is giving anterior spinal artery, posterior spinal artery, sympathetic plexus, as well as the vertebral arteries. The posterior part is giving the connections to the brainstem, which is cerebellum, medulla oblongata, and the meninges. This is all about the foramina, and this is all about the skull.